Hello, welcome to Care Talk. President Trump has released a budget, and the U.S. House continues to deliberate on whether and how much to cut our health care through gutting the Medicaid program. Welcome to Care Talk, where we talk about how healthcare works or doesn't work in America and answer your health insurance and healthcare questions. I'm Laura Packard, cancer survivor and healthcare advocate, here to help you. Please text or call in your questions at 202-838-6837, and we'll answer them in future episodes. Be sure to subscribe to my channel or podcast wherever you get your podcasts to get next week's show. In today's episode, Margarida from Healthcare for America Now has some insights about the Trump budget and the budget package that Congress is working on right now. How will it affect your healthcare? Welcome, Margarida.
Thank you.
So, as we're speaking now, just a few hours ago, the text for some of the budget has been released. And these are things that we've been talking about on our program for weeks and months. And now we actually have the text to talk about. So, can you talk about what we know?
Sure. Well, they released this sucker in the dead of night. So unless you happen to be up at, 1 or 2 in the morning, you maybe, have not read the whole thing. So basically the original instructions for this bill, the resolution that was passed, was giving instructions to committees, to the E&C committee, which is in charge of healthcare. It's the Energy and Commerce Committee, to cut $880 billion out of healthcare, Medicaid. And what we got was a bill that is going to cut around $700 billion out of Medicaid, which is still big. It's historically the biggest cut we've ever seen of this type. And it really makes the cut in two ways. One is it reduces the subsidies on the Affordable Care Act exchanges. So right now, low-income people can purchase coverage on the Affordable Care Act marketplaces. 90% of people that buy the coverage get a tax credit to help them afford that coverage. Those tax credits have gotten more generous because healthcare has gotten more expensive over the last few years. And as a result, we have many more people covered with private insurance because of the marketplaces. Those improvements in the marketplace affordability are going to expire this year. And in this bill that they've released, they do not extend them. So that means that the cost of coverage is going to go way up, and a lot of people are not going to afford it. The CBO, the Congressional Budget Office, did an analysis that it released last night also. And their analysis essentially said, because of that provision in what the Republicans just released as their plan for healthcare, that 5 million people will lose coverage. So that's quite a lot of people. And then on the Medicaid side, which many more people get coverage through Medicaid, we expect 8 million people to lose coverage. And the Republicans had been considering a wide menu of options about how to do this, and some were more controversial than others. And they, right now, if you sort of listen to the news, have a tendency to downplay what they're doing. But the numbers don't lie. We're still talking $700 billion in cuts, and 8 million people are going to lose their coverage. And they're going to do that through a complicated set of things like work requirements, which are really red tape requirements. It's a system by which, rather than spending money on covering people, you're spending a lot of money on every month checking whether or not people are eligible. There's also lots of cuts and tweaks to who can get coverage, lots of tweaks to immigrants. It's already impossible for immigrants. Undocumented immigrants can't get coverage under federal Medicaid. But some states are funding coverage for some portion of the immigrant population, and they're doing that with state money. So the bill goes after that. It kicks the Dreamers off. It eliminates FMAP, which is the federal matching funds for states that have not expanded Medicaid. So there's 10 states that haven't expanded Medicaid and have very high numbers of uninsured people. And it implements copays for the first time. And a lot of people feel like, well, what's the big deal with copays? Well, keep in mind, like Medicaid is a program for very low income people. The vast majority of adults who are on Medicaid already work, right? Almost all of them already work. If they don't work, it's because they're either a full-time caregiver or they've got a chronic disease or they're a student. And when you are low income enough to qualify for Medicaid, you are making, $30,000, right? For a family of four. $35 when you're talking four people as a copay to get something done at the doctor's can add up pretty quickly. So through a series of things like that, they are generating what they think of as savings, though what we really think of as cuts to the program that eventually in the next decade will culminate in millions of people being cut off of healthcare.
Hey, thanks. And it's my understanding, as you mentioned, they are cutting over 700 billion from Medicaid specifically, and
Mhm.
that all the things you talked about all together with the Medicaid cuts, with the Affordable Care Act cuts, and so on, that the CBO says that nearly 14 million Americans will lose their health insurance.
Yeah, that's right. 13.7. And really, when you add up the Medicaid and the ACA, it's 900 billion. So that is really, really a historic cut. I've been in DC 15 years. I've never seen a cut that big really from anything, much less from healthcare, especially in a moment where like everybody knows that we should be really investing more in healthcare because we've got an aging population and aging people, higher numbers of aging people, higher numbers of people with disabilities. That is always going to result in increased healthcare costs. And it really is, a situation where people feel like government should do a better job, right? Government should be working for real people by helping them to figure out how to take care of aging relatives, how to provide healthcare for people with disabilities. Otherwise, that burden falls entirely on families, right? And families are stuck taking care of their own healthcare, providing healthcare for their kids, paying higher housing costs, higher food costs, and then on top of that, trying to figure out how to help their aging relatives afford home care or institutional care or prescription drugs. So it's really, these numbers are terrible, and you're going to hear a lot of GOP members talking about just pleased as punch, talking about how they're saving so much money and how it's really great, and waste, fraud, and abuse. But the truth is, if they were really interested in going after waste, fraud, and abuse in the system, the way to do that is not to take away people's health care, to cut off people's services. It's really to go after providers. It's to go after overpayments in Medicare. It's to go after price gouging, to curb profit, to do something about the monopolization in the healthcare industry. There are lots of other things that they could do to really address what is basically waste and grift in this system, that would save money over 10 years and allow the system to work in a more streamlined way, while at the same time not taking away people's coverage.
And it's also my understanding the reason why they're talking about cutting nearly $1 trillion from our healthcare, taking away healthcare from people that need it most, is to pay for these tax cuts to billionaires and corporations that
Yeah, it's
Elon
really,
Musk Elon Musk needs our money more than we do for our healthcare.
it's a supreme irony. I think I sometimes have it a little bit of difficulty explaining it to people that I know in other countries, because I mean, here are the conservatives basically saying we're not going to renew tax credits that make healthcare more affordable for working people on the ACA exchanges. However, we will bend over backwards and cut healthcare for millions upon millions of people and kick people out of the system and create huge new burdens for states in order to extend the Trump tax breaks for wealthy people and corporations. And that's really who benefits primarily from those tax breaks. Like if you're an average income person, you'll get a little tax break, like maybe a couple $100 out of the extension of the Trump tax cuts. But what you're going to end up paying more for healthcare, whether you lose your healthcare or not, because we all know that when there's soaring numbers of uninsured people, it costs the rest of us money. Having high levels of uninsured people results in cost shifting, and then those of us that have insurance end up paying higher premiums because that cost gets shifted to us. So they have a huge package. It's 4.5 trillion, not billion, $1 trillion in tax breaks to primarily wealthy households. The people that end up getting the most are people making over $450,000. The average tax break if they make these tax breaks permanent, the average tax break for the top 1% is about $45,000 a year. So that's a lot of money for wealthier people who, by the way, have already gotten 5 or 6 years of tax breaks. So we're not even talking about first-time tax breaks. These are tax breaks that are being continued from, passage of this bill back in 2017.
It's my understanding, I think it was a person from Families Over Billionaires that told me that the tax breaks, 70% of the tax package benefits the top 5%, and the 40% of the bottom of taxpayers are actually going to pay more money when you look at all the cuts and everything.
Sure, of course. I mean, so I just think, a lot of the GOP members are stuck in this sort of like what I can only term as like archaic theory of trickle down. And it's baffling. I mean, most regular people understand that rich people getting richer doesn't help the rest of us. Like there's no benefit to making rich people richer. Actually, it's an irony, right? Because the Republicans keep talking about waste, fraud, and abuse. And it's like, I'm having a hard time thinking about like what could be more wasteful than giving rich people more money. Like they have so much money and they're going to keep making money, and they don't pay, even without these tax breaks, wealthy people really don't even pay the same tax rates as middle-class people like firefighters or teachers pay. Because remember, affluent people, wealthy people are by and large making their money off of stock assets, right? They're making their money on the stock market through financial assets, which means that when their wealth increases, right, when the stock market soars like it did during COVID and like it probably will again, it's already back on the upswing during this administration, they're going to collect a whole bunch more wealth, but they will not pay taxes on that wealth because wealth from assets is not taxed in the same way as wealth from work. So if you and I get a promotion on our job and we're making more money, we're going to pay a little bit more tax to reflect our increase in wage income. But that is not true for wealthy people. Wealthy people don't pay more in tax unless they actually sell those assets. And, they're not idiots. They're not going to sell those assets. They're going to pass those assets on to their children and their descendants. And, that's what's creating all this dynastic wealth.
Mm-hmm. So let's talk about the process and the timeline so people know what's going to happen when. So Tuesday this week, at least theoretically, the committees are going to actually start marking up this legislation. So can you talk about that? What does that mean and what happens next?
Yeah, they'll discuss this language that's just been released will be discussed in committee, and then they will hash it out. It's expected to take quite some time, and they will report out what they call a mark. So they'll basically, like imagine taking a red pen going through the bill. They'll get to an agreement. Whatever is that agreement, it may be somewhat different than the language that we saw last night. That's what will be voted on and then reported out of the committee. Each committee is guided by instructions that were passed in a blueprint called the budget resolution back in April. Each committee will report out a mark, and then those marks will all be packaged together into a reconciliation bill. And that's what the budget committee is going to do. And right now they are planning on doing that at the end of this week on Friday. So the committees do their work. They report out their marks. The marks get packaged up into a reconciliation bill by the budget committee. That has to pass through the budget committee. And then next week, assuming this is making a lot of assumptions that things are going to be, that they're going to actually reach agreement on these things in this time period. Then the next week, that bill that comes out of the budget committee will go to the rules committee. Everything has to go to the rules committee before it can go to the floor. So it'll go to the rules committee. The rules committee will make any final tweaks, and then they'll send it to the House floor, and there will be a vote of all the members of the House to pass the bill or not pass the bill. So, and that's just the House process. Remember, we haven't gotten to the Senate yet, but this is the House process. And this timeline's a very quick timeline. It may feel like, oh, a week, great. That seems great. But like in Congress and in legislative land, this would be like Roadrunner Swift if they could get this done, because there's still quite a lot of disagreement among the Republicans. And remember, this is all Republican, right? None of the Democrats are going to support these kinds of cuts. So it's really about the Republicans getting to agreement within their caucus. And the same day that we saw this legislation that was crafted and released last night, a very prominent Republican, Josh Hawley, senator from Missouri, was on the front page of the New York Times saying, I can't support any Medicaid cuts. So there's a pretty significant level of disagreement among Republicans about what to cut, how much to cut, and how that's going to impact. There's a lot of concern about how it's going to impact their states. And just one other thing to note is, Medicaid globally as a program, it's much more important for Republican states than it is for Democratic states. So that is, every state takes up Medicaid, and it's critical. It's the largest source of funding in every single state. But when you look at states like Alabama, Mississippi, Texas, those states are even more dependent on Medicaid funding. So it's ironic to see Republican leaders really hacking into this program that is so essential for so many of the constituents in their districts.
Mm-hmm. And I know I've heard that over 40% of Speaker Johnson's own constituents depend on Medicaid.
Right. I mean, he is one of the most, Louisiana, one of the most Medicaid dependent states. And even just, I mean, it's not even just healthcare. When you think about like the role that Medicaid plays in schools, or you think about the role that it plays in the criminal justice system, just in terms of like the prevention of crime, right? I mean, Medicaid funds substance use disorder. If you don't have funding for addiction treatment or mental health or behavioral health, there's only one place really for a lot of people to go to, and that'll be into jails and prisons. And that creates a whole other set of costs. So, they are sort of talking and acting like they're trying to be supremely fiscally responsible. But the truth is, they're sort of moving deck chairs around on the Titanic. It's like, if you take away people's health care, there is going to be consequences down the road. And those consequences are going to play out in health outcomes, in crime, in higher rates of disability. Even, some of the stuff that you combine what they're doing with Medicaid with what we're seeing on food stamps and the cuts that we're seeing, for research and for CDC, like, we are really headed to a pretty dangerous place, I think, on healthcare.
Mm-hmm. And I just heard today that all of these dramatic cuts, that this whole budget package just blows a hole through the deficit. So it's not even solving the problem that many of these elected officials claim to care about. It's making everything worse.
I mean, when you want 4.5 trillion in tax breaks, you can't really claim that you care about the deficit, right? Like, tax breaks for rich people cost money. And when the Trump tax law passed the first time in December of 2017, most of those tax cuts weren't paid for, and they added over $1.5 trillion to the deficit. Right. So it doesn't, the Republicans have really undercut their own credibility talking about the deficit, this, that, and the other. The reality is, this is not about the deficit. They're running the government, and they have a choice about how to spend money. And they are choosing to spend 4.5 trillion on tax breaks, right? That, as you said, 70% of those tax breaks are going to the richest 5%. That's not a strategy for economic stimulus that broadly impacts or broadly supports a thriving economy, right? So It's silly for them to say, well, we can no longer afford healthcare for this person. Well, listen, if you can afford 4.5 an additional, trillion in additional tax breaks for rich people, we can afford healthcare for old people and working people.
Thank you so much for joining us, Margarita, even though the news is not good.
Mm.
And next, welcome Louise Norris from healthinsurance.org and Diane Archer from Just Care and Social Security Works to answer your questions. And let's start with Trump's executive order on drug prices. So, what is it? What does it do? And what does it not do?
Great questions, Laura. I think this sounds like good news, but the reality is that it's a lot of sizzle and there doesn't seem to be any there. We can hope, but right now what the executive order does is what President Trump said he was going to do yesterday, it does not do. So yesterday he said he was going to give Americans a big cut in drug prices, lower their drug prices by more than half. And then today, what his executive order did was it simply requested that the pharmaceutical industry voluntarily lower its prices with no clear enforcement mechanism if they don't do so. So he made a very lovely announcement that sounds great, but he did not lower drug prices, and it's not clear he will. We do know that this is one of the Americans' top policy priorities, so it's smart for him to be talking about lowering drug prices. But what he also knows is when he tried to do so in his first term, he got sued by the pharmaceutical industry, and his small effort to lower drug prices was completely blocked.
So, what could he have done, or what could President Trump still do if he wants to lower drug prices? Because it sounds like this executive order is not it.
Yeah. So actually, I'm talking about the need of Republicans to find money in the budget to save, to cut. One thing that the president could do is say to the Republicans what he said to Americans, that he doesn't want to cut Medicaid, if he really doesn't want to cut Medicaid, and direct the Republicans in Congress to mandate lower drug prices in their reconciliation package. That he could do. It would be tricky, but he could do it, and it would save a bundle of money. Instead, it looks as if, as Margarida has just said, that they're moving along in Congress to cut Medicaid benefits and healthcare benefits to nearly 14 million Americans. So there are options, and yet the president hasn't really been supporting what we really need, which is a strong Medicaid program, a strong Medicare program, and lower prescription drug prices. The other thing the president could do right now is allow anybody, including pharmacies, to import drugs at lower costs from any verified pharmacy in the world. We would then know that the drugs were safe and effective. And if the pharmacies could import those drugs from abroad, they would pay a lot less than they're paying pharmacy benefit managers here in this country. And people would likely pay a lot less for their drugs at the drugstore.
Mm-hmm. And going back to what Congress could do, what President Trump could direct Congress to do, the Affordable Care Act set up Medicare drug price negotiations with so many drugs by so many years, so they could speed that process up. They could negotiate for more drugs. They could limit the patent time, to make it shorter before there's competition. So these are things that Congress could do to save billions and billions of dollars and lower drug prices, right?
That you are so right. And in fact, the big point here is that the president has actually directed Congress to slow down drug price negotiation, to give the pharmaceutical companies more time to set prices on high-priced drugs, to make it harder for people with Medicare to get lower-cost drugs, and to actually, according to the Kaiser Family Foundation, make it impossible for people with Medicare to see the savings that has already been negotiated beginning next year on drug prices for 10 drugs. I think as a result of what President Trump is proposing to Congress, we would only see lower drug prices on maybe half that many drugs next year and the year after. So we are seeing some action on this front, and the action is going against what the president is saying and actually would drive up drug prices for people with Medicare.
Thanks, Diane. And it sounds like President Trump is saying the right things, but now we need action to back it up. And there are plenty of things that President Trump and or Congress could do to lower drug prices. They just haven't.
Exactly.
And now the question from Sarah Runs Texas, who says, I'm getting my first mammogram today. Last week, the hospital sent me a $600 estimate and asked me to prepay before being seen. I called my insurance because I thought I was covered, and I was. My insurance called the hospital, who told them that the $600 bill was an automated message. It didn't actually reflect my bill. I wonder how many women canceled their preventative care appointments or gave the hospital an interest-free loan over such a predatory practice. So, Louise, let's talk about when people are billed for things that should be covered under preventative care.
Absolutely. So a mammogram is a perfect example of care that sometimes is free under your health plan and sometimes you have to pay for. It depends on the specifics. If it's a preventive mammogram, which means you have nothing that you're trying to get looked at, there's no lumps, there's no symptoms, and you're just on the regular recommended schedule based on your age, then that is covered in full by most health insurance plans in the United States, which means you shouldn't have to pay anything for the mammogram itself, for a facility fee, for the radiologist to read it. There should be no costs to you. On the other hand, if you or your doctor find a lump, or if you're going in for a follow-up mammogram because something was found on a previous mammogram, you're going more often than the recommended just screening guidelines, then you will have to pay your health plan's cost sharing. What's particularly interesting about this case is the hospital was just asking for $600, which is kind of a random number, because if you do have to pay for your mammogram because it's diagnostic rather than preventive, the specifics of what you're going to have to pay are going to depend on your health plan. It will depend on what your plan's deductible is, how your plan covers mammograms, whether you have to pay a flat amount or a co-insurance. It's going to be different for every person. So there's no real correct scenario where a hospital should be asking people to pay a random $600 amount, especially in this case, since it sounds like this was supposed to be a preventive mammogram. So it's good that you called and got it sorted out and didn't have to pay it. If you feel like pushing the issue further, you can certainly reach out to the hospital and let them know that this is, there's no justification for this. Some people will take something like this to the media and get it publicized out there that medical facilities should not be doing that.
Mm-hmm. Well, thank you for that, Louise. And for our final question, this is a nice, easy question to answer. How do we make an unbroken healthcare system besides better medical training, insurance, increasing health? So, Diane, how do we make a better healthcare system?
Well, we can look at examples from other countries. And I think what we know from other countries is that healthcare systems that work well are not profit, are guaranteed and universal, covering everyone at an affordable price. And we do have a model in traditional Medicare, which is the government administered healthcare system for older adults and people with disabilities, It is very cost effective, and it gives people what I like to call one size fits all healthcare. So you don't have to make a choice of which health plan. It's always a choice people are making basically with their eyes closed, because the information isn't there to know which ones will meet their needs and which ones won't. With traditional Medicare, you have all the choice in the world. You get to choose which doctors you go to. You get to choose which hospitals you use. You get to get care anywhere in the country that you happen to be when you happen to be there. And if you're a treating physician and you agree that a particular treatment is wise for your condition, the government isn't second guessing the treating physician, as happens in the corporate health insurance world. So I think what we would need to do is to move into a traditional Medicare for all type model to get an affordable, guaranteed system that gives everybody the care they need from the doctors and hospitals they want to use when they need that care.
Not a good goal, not so easy to get there, but we can keep working to make the healthcare system that we live under better. And just wanted to point out again that Congress right now is making decisions. They're making choices with your money, with my money, with our taxpayer dollars, where they're going to spend that money. They could spend that money to expand our care, to make our healthcare system better. But at the moment, the House is working on a plan that would take away care from nearly 14 million Americans to pay for tax breaks to billionaires and corporations. So those are choices. If you do not agree with those choices, you should talk to your elected officials and remember that they work for you, and they should be hearing from you with what you think they should be doing. So thank you for joining us today to learn more about the federal budget and the proposed cuts to our healthcare. Please text or call in your health insurance and healthcare questions at 202-838-6837, and we'll answer them in future episodes. Join us next week for more on healthcare in America. Be sure to subscribe to my channel or podcast wherever you get your podcasts. My name is Laura Packard, and this is Care Talk.